Funding support for Presente is provided by Joseph and Elizabeth Walder Charitable Fund and generous Chicagoans like you.
Welcome to Presente, where we speak to leaders who are showing up for our community by actively fostering grassroots solutions to challenging social problems. I'm Francia Garcia Hernandez, your host. Today, we explore how indigenous and ceremonial health practices are being rediscovered in Chicago thanks to immigrant communities. Ancestral practices like sound baths, Reiki, limpias, meditation, and ceremonial practices have long been used by indigenous communities and other cultures worldwide to improve well-being and health. Can they be part of modern healthcare? We talk to practitioners and experts to learn more. First, let's see what the local group, Papalotzin Healing Collective, is doing in your neighborhood. Cristina Pucio, thank you so much for having us here at El Paseo Community Garden here in Pilsen. You are a member and founder of Papalotzin Healing Collective, a group that has provided this space for healing for many neighbors throughout the summer, where they participate in Reiki, in sound healing, in limpias, in all sorts of different practices to help them and help yourself as well. So tell us a little bit about these practices and what you do.
So there's many practices that we do. So the event that we have on Wednesdays, it is called Meditation and Sound Healing. And it takes place outdoors here. And it happens from 6:30 to 8:30 p.m. And what I do specifically is I offer meditation in the beginning of the session. It's usually like 10 minutes. And then usually we also open the directions, which is another indigenous practice that we like to combine as well. And then we do the sound bath, the sound journey, where we have different instruments. Now, these are not all the instruments that we use. We have gongs, we have crystal bowls, singing bowls, flutes, shakers. Some of them are modern instruments and others are more traditional instruments.
It's so important to have it here in Pilsen, where there's an important Mexican community that is reconnecting with practices that otherwise would be lost and that we may not see in other parts of the city. Tell me a little bit about setting directions. What does that mean? What does that entail? And what's the origin of that practice?
So from what I know, the indigenous people in the Americas, so not just here, but in Mexico, Central America, South America, they all have this practice. And it's just basically to honor the elements, the ancestors, and just to kind of connect with the land. And it's just something that we incorporated, and ever since then, people just enjoy it. And it's a way to also honor this land as well.
Let us face the direction of the south.
Kat Belmares, member of Papalotzin Healing Collective and sound therapy specialist. Thank you for having us here. It's an honor.
Thank you for being with us as well.
One of the things that you do here with the collective is sound therapy. For those who don't know what that is, can you explain a little bit of what these entails and what benefits it can bring to people?
For sure. The new buzzword is sound therapy, sound healing, sound journeys. However, this is something that like our ancestors around the world used in some way, shape, or form for ritual, ceremony, healing, celebration, initiations, transitions, you name it. What the sound therapies do is they activate the parasympathetic nervous system, which calms the body. And when the body is calm and in that state, it allows for its own repair, because so the body is repairing itself.
From what you're mentioning, we're starting to see here how science and maybe more traditional Western medicine can intersect and complement with these practices that are also health practices. What do you think is the vision going forward for healthcare and preventive healthcare, especially in communities like Pilsen, where you need to have a little bit of both?
I hope and I envision a future where we can bridge both the traditional medicines and the modern medicines. I think that they are both have an important place in our society, and I think our indigenous elders that still carry that knowledge have so much to share with us. But we as humans, as we evolve, you know, we can't go back to obviously what we were. So we have to learn how to bridge and incorporate the medicine that we had prior and the medicine that we have now. And I think once we're able to do that, we can stop fighting about which one is better and really just start to look at things from a different angle. And, you know, we see the pitfalls of modern medicine, how it sometimes can just, you know, take care of the symptom, and traditional medicine, I think, addresses the roots. So together, I think they can be a really beautiful partnership.
In your experience here at Papalotzin, why is community so important?
Well, it's important to me in the sense that it allows me to be myself, and it allows me to not become cynical, to not lose hope, or to not get stuck in something, right? Like, it can bring me out of something, and also community means a lot, especially when people are being divisive, right? Like politics and all these things, right, bring divisiveness, and here we can try to like bring togetherness, right? We could bring the opposite of what is hindering us in building community. And also because we're in Pilsen, and sadly a lot of people are being pushed out, right? Gentrification, this thing about the TIF going on. So I think it's important to like know that people can still get together and gather. And even if we are different, I think it's okay too to have differences and still sit together and kind of like enjoy the sound healing and know that we're all human, we're all spiritual beings.
You know, people do continuously tell me like how it's allowed them to slow down, it's made them think more, it's even empowered them to take their own healing into their own hands, which is so exciting because that's really the goal, I feel. And then eventually offer things themselves. So I think, you know, we need as many people coming into their own empowerment and empowering others to do the same.
Through communal practices rooted in indigenous and ancestral cultures, Papalotzin Healing Collective members fill a gap in mental, emotional, and physical care and build stronger relationships in Pilsen and other neighborhoods. Next, on Presente, Dr. Geraldine Luna, Medical Director for the Chicago Department of Public Health, will discuss whether indigenous practices can help prevent disease and improve Latino health.
I'm Ricky Watson, inviting you to join me for the next critical conversation, where we focus on the importance of mental health, making sense of your purpose, and doing the impossible. Tune in for our opportunity to be inspired, enlightened, and encouraged. Join the conversation on CAN TV Cable Channel 19, or stream live on cantv.org or on the CAN TV Plus app. Elevated conversation and storytelling. Experience the power of community television.
You're watching Presente, where we speak with leaders who lift our communities by nurturing solutions to challenges. Today's program focuses on alternative and indigenous health practices being rediscovered by Chicago's immigrant communities. We visited Pilsen's El Paseo Garden to meet Papalotzin Healing Collective. In this space, community leaders and practitioners of indigenous and ancestral practices bring neighbors sound baths, meditation, Reiki, curanderismo, smoke cleanses, and grounding, among other ceremonial practices. These practices date hundreds of years. They were first adopted by American indigenous group, China, and Japan, among other ancestral cultures, and then lost due to colonization and the widespread adoption of Western medicine. A 2020 review of research studies showed there is some evidence that sound baths using singing bowls improve anxiety, depression, fatigue, tension, anger, confusion, and vigor. There are signs they could also improve blood pressure, heart rate, and respiratory rates. Yet, more research is needed. Dr. Geraldine Luna, Medical Director for the Chicago Department of Public Health, is joining me today to discuss the potential of these practices in improving health. Dr. Luna, welcome to Presente.
Thank you for having me.
Thank you for being here. Let's get into it. So we visited Papalotes in Healing Collective, a local group that is trying to improve health in some Chicago communities and bring wellness to our neighbors. We know that there are still some disparities when it comes to Black, Latino, and white communities in the city, and there is a significant life expectancy gap among some of these communities. Can you tell us a little bit more about what the city is doing to bridge this gap?
Of course, and it's so sad to see that the majority of the city residents right now and community members are of color, and yet you see that the disparities is specific for colors. And we're talking African Americans, Latino, having significant changes. For example, COVID-19 disproportionately hit Latinos, African Americans, where we saw ourselves 3 times at risk of suffering the disease because of the nature of what we do as city members, essential workers, multi-generational families living together. All those social determinants of health, which are so important, have affected us. Well, the city is very excited. Our new model of care, like Healthy Chicago 2025, moving now to 2030, is a different approach, co-lead approach, where we're working in strong collaboration with community-based organizations and city allies representative of the communities. So our 77 communities have been divided in 6 big regions, and it's because the strategy to tackle those disparities are affected by the way we are located, west side, north side, south side, and that's what we're doing. We're calling these regions Healthy Chicago equity zones, which means that working with people from there is the best way to connect with individuals because they represent us, because they're embedded day by day, because they're trusted voices, and because they practice what is social and in community, in this case, cultural sensitivity, humility, which translate to being receptive to the people's needs.
Right, and there's so much to unpack in this plan that you just mentioned, and I'm sure there have been many considerations going into it. But one of the things that stands out is you're talking about a new model of care. And I would like to dive into a little bit of why that is important. So I was looking through some nationwide data and CDC data, and it shows that 90% of $4.5 trillion that are spent in healthcare is for treatment, not prevention. We're not getting to disease before it begins. We're not necessarily promoting healthy lifestyles. We're getting to care once disease is here, once there's a chronic condition, once people are dealing with cancer or have a major accident or disease that leads to disability. So can you tell me a little bit more about the role of indigenous and ancestral practices in preventive healthcare? Is that a possibility?
Yes, and I'm glad that you bring it because that 4.1 trillion of money is reactive care. You just said it. You can't put it better, that it leads to nothing. It's going to the emergency room when you already have a disease and it's so advanced that it's very little you can do. And all the resources are going there to try to stop something from being unstoppable at that stage. So the important things of bringing people back to their roots is that we have seen a lot of studies out there that when people feel at home, that they can express their identities, that they feel comfortable, and the systems around them support those individuals, that community, to express themselves, is when we see that people are at a place to receive information, to empower, to look, actively be part of decision making and change the way they see their health. This is another thing. There is a lot of studies, especially from public health, that the way that you perceive your health to be is the outcomes that you see. So if I feel that my health is very poor, it's very likely that my life in this, my years in this world, as I know myself, are coming to an end. And we have seen it If my health is perceived as poor, or that I'm being like not treated properly, or I can't really look for help that understands me, that I can express, that I can communicate, something as simple as language, that people understand me and don't dismiss me, it's directly related to health outcomes and have a significant impact on what they are. So I think bringing back the people to their roots, to how I see myself, expressing myself, and actively being part of those exchange and communication of the dynamics of my doctors, my medical group, and the people around me, and seeking health that is mentally supporting me. Behavioral health is an important component of well-being. It's a way to move to a new model of care that makes more sense and it's more cost effective. We're looking to promote preventative care. Anything that keeps me from that emergency room, disability, or becoming a social charge is what we want. We want our communities to be self-sustainable, healthy, and see everybody develop their full potential as individuals, contributing to the economy of this country and happily pursuing your happiness in the United States of America.
Okay. I think you touched on something that is really, really important, and that is the fact that individuals are looking for something that maybe resonates with them, and maybe they're more willing to seek care if it resonates with them. So one of the things we heard from Papalots in Healing Collective is that oftentimes they hold special sessions for processing grief or trauma, or bringing elders from an elderly home nearby and other generations together. They cite benefits as, feeling more grounded, they release stress, they're able to cope with this grief and with their emotions. From a medical perspective, can you tell us a little bit about why practices like Reiki, meditation, or the singing bowls and sound baths can promote the sense of well-being?
Yes, is that we call that practices, which is very mental health related, we call that like self-care. When you meditate, when you're doing your yoga, when you're doing your limpia. I mean, who hasn't experienced that? As a Latino, my abuelita would take us to una curandera, where she would give us the sobos, which means those massage that promoted health, the faith, going back to your roots, the way that we see our health, that we see every ethnicity, every group, even individually, you see your health very differently. And being able to express those and going back home, going back what feels welcoming to me has an incredible impact in mental health, which eventually translates to physical health and puts you on a better path to succeed when we're talking about financial health, which is the third component of well-being of a human being. So anything that has to do mi tececito, which is a tea that improves my health. If I'm feeling I have a cold and I want to look for mi tececito de menta, mi tececito de canela, because there's property there that have proven to improve your immune system, for example, those are welcoming. And those are something that we enforce and we tell our community we want to see that happen. It is an environmental approach with community, with people that understand you, and a system of healthcare that you consider as my medical home, that they understand me. My doctor looks like me. They speak like me. They listen to me. The things that I consider, maybe if I go to another individual or dismissive or somebody that sees me as race different or is not culturally humble to receive the information that I want to give, maybe I'm not going to get the same responses and I'm not going to be in the same position to receive medical attention, to receive instructions that I can follow and that are respective to who I am as an individual and as a cultural member.
It sounds like you're talking about empowering people to take their health in their own hands, to do something about it, to feel like they're getting the care they need, but also go home and practice a healthy lifestyle. What are the barriers, if any, to integrating some of these practices like we just talked about, like our tecito, maybe a sound bath, maybe taking 5 minutes to meditate, into Western medicine? Maybe that's something that many people in our communities have gone to a doctor and they've never seen their doctor prescribe, go participate in the sound bath. What are some of those barriers preventing them from having that?
I think there is no support to it. I think if you go to a doctor of medical home that doesn't understand who you are, where you come from, or have anything in common to you, live experiences, cultural backgrounds that understand the significance of some practices that are very traditional, they're very treasured, and to us, they will not support, like, don't, what are you talking about? Maybe this is witchcraft. So that positions an individual of being like less likely to practice those or try to acculturate to fit in a system where the system should be fitting to serve you. So this, what we're seeing right now is a nonsense in the way that we practice healthcare. Healthcare should be delivering catering to the patient's need. If I need to grieve, having a support group is not only about la limpia or the smoking or the, a lot of that, what goes behind it is because that evokes things that are familiar to me, where I feel this is the group that I can grieve, and I have my support group right there, which we know has a significant benefits in healthcare outcomes. So positioning a patient or giving or supporting or fostering an environment that individuals can feel comfortable expressing themselves, I don't know how we can go wrong with that. If that's going to make our patients more open to exchange information, to have that perfect report and compliance with medical care, where we bring all of you as a whole to a place where we can provide you the health care. The individual is going to be more motivated, positive mindset, which is now being reflected in a lot of things that can take over as a doctor that I'm promoting and I'm recommending, and putting all those together and feeling in a sense of community, which ultimately is how you want people to understand their environment and feel about the places that they're interacting with.
We're talking about so many different components of health, and community plays a role in this. I think oftentimes we've seen Latinos think of healthcare as we go to the doctor, we go to the ER, we go to a hospital if we need it. But we don't see a community group like Papalotzin, where people, neighbors, people who look like us, are coming together and saying, let's do this, and this is also healthcare. I think that's a significant difference. Do you see the city and more public institutions working with groups like Papalotzin to bring healthcare to communities in Chicago and other parts of the nation? Is that a possibility that we might see in the future?
Well, we're promoting anything, and healthcare is a big part of this administration of what the Chicago Department of Public Health is looking for. These are active conversation. A lot is going into this collaborative efforts from community member, a community-based organization, even a representative are all aligned that what is trauma-informed healthcare is an important part of mental health, and it's therefore part of our well-being. So we see ourselves, we're doing that a lot. We even have promotores de salud now that they go out. This is a very antique way of knocking on the door one by one, these interactions, and your doctors, your nurses, your healthcare provider, now your community health worker that knows you from from years and years and know your community. Now we're sharing that information. Wouldn't it be beautiful to, instead of giving a pill to decrease your blood pressure because you're so anxious, and treating anxiety with a pill, give you a pamphlet where you can go and start meditation and start seeing your group and getting your emotional support from people that know you, from practices that are familiar to you, and it's going to decrease the blood pressure. As you mentioned, there are studies out there which these support groups do to you, practice religious practices and traditional ancestral practices do overall to your health. So I don't see how not. This merge has to happen, because this is who the patient's is, the patient's individuality, the patient's identity, how they see themselves, and medicine has to represent you.
Right. It's a very exciting conversation. It's a very exciting future for healthcare, where community, society, culture, and our economy all comes into play to really improve health outcomes and see healthier Chicagoans, healthier Latinos, healthier people overall. There is so much more to unpack, but unfortunately we are out of time, surprisingly. Thank you so much for being here, for sharing your insight, your experience, and the future of promise that could be better healthcare for all, and one that we can see ourselves in.
Thank you for having me.
Thank you. As we have heard, indigenous and alternative health practices can be part of a healthy lifestyle, build stronger communities, and potentially help prevent and treat chronic diseases, mental illness, and other conditions. Barriers remain and more research is needed before we see indigenous practices blended with Western medicine. In The Common Ground, we discuss what medical experts and community leaders agree on, that groups like Papalotzin Healing Collective provide neighbors with an option to feel better physically, mentally, and emotionally.
I'm Darius Hillman. On the next edition of Chicago Noir, I'll introduce you to 3 incredible leaders working to positively impact outcomes for Chicago's most at-risk communities. Join the conversation on CAN TV Cable Channel 19 or stream live on cantv.org or on the CAN TV Plus app. Elevated conversation and storytelling. Experience the power of community television.
Immigrant communities in Chicago are rediscovering indigenous health practices lost due to colonization and the adoption of Western medicine. Offering these practices in Latino communities increases access and helps neighbors heal. Groups like Papalotzin Healing Collective also preserve ancestral knowledge and help Latinos reconnect with their culture. For some Latinos, participating in a sound bath or grounding ceremony to process grief may be a better or more accessible alternative than going to therapy. Other participants can attest to the health benefits of practices like sound baths, meditation, Reiki, curanderismo, limpias, grounding ceremonies. They feel less anxious, release tension from their body, improve their breathing, and overall feel mentally, physically, and emotionally better. More research is needed to confirm exactly how some of these practices have effects on the human body and whether they can be used to treat specific diseases. At the same time, public health approaches and health experts recognize preventive health care is critical, and preventive care must be culturally relevant and accessible to succeed. Community leaders like Cristina Pucio and Kat Belmares have experienced firsthand the benefits of sound baths, meditation, Reiki, curanderismo, and other practices rooted in indigenous and ancestral cultures. They have seen more Pilsen, Gage Park, Uptown, and Chicago neighbors participate, learn, and improve their health and well-being. More research is needed, yet medical experts and community members understand that groups like Papalotzin Healing Collective provide our Latino neighbors access to practices that help them feel better physically, mentally, and emotionally, which could lead to better health in the long run. What do you think? We want to know. Contact us via Instagram because you are more than just our audience. You are our contributors. Thank you for joining us on Presente. I'm Francia Garcia Hernandez.